Hello there, and welcome back to my channel, the N.E.T. Nurse. My name is Julianne Marino. One of the primary functions of our bodies is self-preservation. We are simply hardwired to protect ourselves. When we feel fear, anger, or anxiety, for example, the area of our brain called the limbic system interprets that emotion as a sign that we're in danger, that something is wrong or unfair, or that something could go wrong. Then, a complex cascade of events immediately kicks off to ensure our survival. This is what is referred to as the fight, flight, or freeze reaction of our autonomic nervous system. It's not a choice we make consciously, but a hardwired biological response to a real or perceived threat. It happens automatically, and it changes the physiology of our entire body. Our brain signals our body to release complex chemicals or hormones called cortisol and adrenaline. These powerful hormones, in turn, increase our heart and respiratory rates, sharpen our senses, tense our muscles, and slow down our digestion and other non-emergency functions, all to prepare our bodies to react immediately. Our emotional responses in the moment influence how we respond to these real or perceived threats. If we are fearful, we might try to avoid or escape the threat. If we are angry, we might confront or argue. When we are feeling overwhelmed by the threat, we might freeze or shut down. This acute stress response is typically short-term. Once the threat is over and we have processed the stressful experience and the intense emotions that accompany it, our heart stops racing, our breath slows down, our muscles relax, and the body reverts from fight, flight, or freeze to what we call homeostasis, or rest and digest. Except when it doesn't. You see, too often we are unable to process real or perceived threats. Either they are too big for us, or we are too little for them, or we are particularly vulnerable for other reasons, such as illness or adversity. In these cases, the body says, in effect, don't worry about this right now. I'm just going to store this stressor over here until you're ready to deal with it. Then it files this unresolved stressor as a pattern, if you will, so it can immediately recognize and respond to it should it appear again in the future. Remember, the body is hardwired to protect itself. The problem is, these stress patterns remain active long after we experience the original event. And active stress patterns result in chronic stress response, which, unlike the acute stress response, is not short-term. The chronic stress response keeps our bodies in a state of constant physiological arousal. So we feel as though we are perpetually under attack, under threat, even when no immediate danger exists. In a future video, I will cover how that makes us feel and how it affects our bodies and our behavior. Right now, though, I want to show you how it affects our brains. In 2016, Dr. Dan Monti, professor of integrative medicine at the Marcus Institute of Integrative Health at Thomas Jefferson University in Philadelphia, Pennsylvania, and his colleagues there conducted a study with 23 cancer survivors who were continuing to experience distressing cancer-related memories associated with traumatic stress symptoms of at least 6 months in duration. Dr. Monti and his team worked with each of the patients to develop a script like the one she or he heard when they were informed of their diagnosis. They then read the script to the patients as the patient underwent functional MRI imaging to measure and record the effect of that stressor on their brains. In Figure 1, the images at the top of the page, we can see what the stress response center or limbic system of the brain looks like during the re-experiencing of that trauma. It is on fire, as evidenced by the hot spots shown in red. The researchers then treated each of the patients with N.E.T. The result? As you can see from the second set of images, the brains of these traumatized cancer survivors returned to normal, healthy functioning, even when they were again exposed to the same stressor, the script, that was traumatic for them before treatment. In other words, their brains were no longer on fire, no longer stuck in that chronic stress response. These images and the study itself were published in the Journal of Cancer Survivorship in 2017. And this is just one of many published research articles demonstrating why patients feel better after N.E.T. Do you ever feel anxious, overwhelmed, or on edge, even when nothing is wrong? Your brain could be on fire from unresolved stress, and N.E.T. can help. Remember this: you are fearfully and wonderfully made. Your body has instinctive self-knowledge and an innate ability to heal. If this resonates with you, please stay tuned to this channel for what comes next. And if you're in the Philly 5-county area, please don't hesitate to reach out to me at my private N.E.T. practice, Onward Health, for a free consultation. Finally, if you find this information valuable, please like it, subscribe to my channel, and share. I'll see you in the next video.